Hi there, you're welcome to Rx Care channel today. Thank you so much for checking us out for your medication needs today, and we would love for you to be a part of our community here at Rx Care. In order to do that, make sure you hit that like and subscribe button down below, and also you can check out our free recipe to one of our diet plans here at Rx Care by clicking on the link below, and it will direct you to how you can download that recipe for that diet plan that we do have on our website. Thank you so much for checking us out again, and please stay tuned. Hi there. So let's go ahead and talk about our medication of choice today. So our medication of choice today is known as Ciprofloxacin. So the brand name for Ciprofloxacin is known as CIPRO. So this medication can be used for treatment of a wide range of infections such as chronic bronchitis. It can be used for bacterial meningitis. It can be used for anthrax. It can be used for pneumonia in patients who have HIV. It can be used for typhoid. It can be used for UTI. It can be used for skin infection, just a whole bunch of infection. This medication is like usually a go-to or the last, most likely the last line because of the medication side effect. It's usually not one of the first few medication. If they could avoid it, they normally would. But this medication is very effective in terms of treating various form of infection, and because of its potency or because of how effective this is, like I said, it's usually our last line of medication because not only is it potent, but it also has, some side effect that some physicians try to run away from. So that's my little spiel about this medication. So let's go ahead and talk about how this medication comes, what to look out for while taking this medication. So this medication comes in an ear suspension. It comes in an ear drop, a suspension, and a tablet form. And it's usually for patients who are taking the tablet form, it's taken as a 500 milligram tablet twice a day. Rarely would you see this medication being used once a day. Most times it's twice a day. If it's used once a day, maybe because you're taking a higher dose, or depending on what is being treated. Like I said, it's used for a vast number of infections. So depending on what they're treating, that would be what would determine what dose the doctor goes with. But it usually comes in a 250 milligram as well as the 500 milligram tablet. So what are the side effects to look out for while taking this medication? So the medication can cause rash, it can cause diarrhea, it can cause nausea and vomiting, it can cause headache, restlessness, confusion. It can also cause some nasal discharge, as well as a condition called nasopharyngitis, like the inflammation of the nasal slash the pharynx area, like your throat area. So those are just some common side effects of the medication. So what about serious side effect that you definitely want to reach out to your doctor for while you're on this medication? So some serious side effect of this medication includes liver failure, like if you start noticing any form of yellow skin, any form of severe nausea and vomiting, any form of like a cold, clammy skin. You want to make sure that you're definitely reaching out to your doctor and saying, hey, this is how I've been feeling. Is this, do you think this is related to the medication? If so, can I switch to another alternate medication? Also in terms of serious side effect, this medication can cause low blood sugar, so you definitely want to look out for that. It can cause tendon inflammation, which is usually one of the big side effects of this medication. So I've noticed that patients who take this medication, it is kind of related to some type of tendonitis or tendon inflammation, usually around the ankle area, like the Achilles tendon is what they call it. And they've noticed that it doesn't even matter what the timeline is. They've just noticed that some patients get a tendonitis form, which could be immediately, not not immediately, maybe after a day of taking the medication, maybe immediately in terms of after stopping the medication, or a couple of months to a couple of years later. So this is just a serious side effect of the medication. You want to make sure that you're reaching out to your doctor. If you already have something going on with your Achilles tendon, this is most likely not a medication that you want to try. You want to see if you have other options other than this medication before going over to this medication. Also, if you start noticing any form of hallucination, any form of delirium, depression, a peripheral nerve issue, when you start taking this medication, you definitely want to reach out. So a peripheral nerve pain or peripheral nerve tingling, make sure that you're reaching out to your doctor regarding that. Also, this medication, if used for a long time, they have noticed that it can cause a form of diarrhea called C. diff. So you want to make sure that you're reaching out to your doctor if you start noticing any severe diarrhea that is just continuous. And this diarrhea can take up to 2 months or more after you stop taking the medication. Like I said, this doesn't happen to everyone. Usually it happens in patients who take it for a long period of time. So that's why it's usually recommended for patients to take antibiotic for only a short period of time, to which, it's able to reduce or subside the infection that they're treating it with. And once that infection is gone, make sure you finish the course of the therapy and you don't use it for more than a longer time possible. All right. So also in patients who have memory impairment, if you start noticing any memory impairment form, make sure you're reaching out to your doctor. These are also some serious adverse effects that have been reported while taking this medication. But like I said, this doesn't take out of the effectiveness of this medication. This medication is super effective for treating various forms of infection. These are just some serious adverse effects that have been reported in the past. It may or may not apply to you, so you want to make sure you give the medication a try and before reaching out to your doctor and saying, hey, I can't remember what I ate last night. Do you think it's because of this medication? You want to be fully convinced that I think, ever since I've started this medication, that's when it started. So before, tendering that to your doctor, that way you're fully able to defend what you're complaining about or what the adverse effect is. All right, so in terms of what to look out for while also taking this medication, the medication can increase your skin sensitivity to the sun. So you definitely want to make sure that you're avoiding exposure, excessive exposure to sunlight when you're on this medication. You want to make sure that you're avoiding tanning beds, as well as, excessive exposure to sunlight or, like I said, heat. While you're on this medication, making sure that you're wearing your sunscreen while you're on this medication is also important if you are going to be outdoor for a long period of time. Also, for our patients taking this medication, the medication may cause dizziness, or it may kind of affect your mental coordination. So you want to make sure that if you are going to be doing something that requires for you to be mentally alert, that you do understand how your body tolerates this medication in terms of your mental state before, taking the medication, and then you're driving and then you have some form of dizziness and then you have to park. So that way you don't get yourself in that kind of situation. You already understand that this medication doesn't really cause dizziness. I've used it a couple of times. I don't think it's going to affect me in any sort of manner in terms of my mental state before doing something that requires for you to be mentally alert. All right, so this medication should also not be taken with dairy products. So this medication can cause something called chelation when it comes in contact with those dairy products. So if you are going to take something that contains like a calcium or like a milk product or yogurt, or like I said, calcium fortified juice, make sure that you're separating it or avoiding it while you're taking this medication. That way the medication can work effectively. Also, you want to make sure that you're taking this medication 2 hours before or 6 hours after taking any other medication that may have some form of magnesium, aluminum, iron, calcium, or zinc. Like I said, to kind of avoid that chelation and making sure that that medication is working appropriately. All right. Also, in terms of patient who miss a dose while taking this medication, so if you do miss a dose and it's within 6 hours from the next dose, you want to make sure that you're skipping that dose and not taking it within 6 hours of taking the next dose. So like I said, this medication is usually twice a day, so you want to space it out about 12 hours, so every 12 hours. So if it's within 6 hours and you missed your morning dose, let's say you're supposed to take it at 8 o'clock, and you 8 o'clock, let's say you take it at 8 a.m. and you take the nighttime one at 8 p.m. and you miss the 8 o'clock and you remember that you didn't take the medication at 4 p.m. and it's almost 8 p.m. for your next dose, make sure you skip that dose and take your next dose, which is at 8 p.m. But with antibiotics, one thing that you don't definitely want to do is miss a dose of the medication. Usually you want to keep to the therapy and how it's prescribed in order for it to work effectively. That way it doesn't make the bacteria even more stronger and harder to treat when next you use this medication. So that's just a little antibiotic tip. When it comes to a lot of antibiotics, you want to make sure that you're taking it as recommended, taking it and keeping to the times you're supposed to take it. That way it doesn't affect how the medication works, and it doesn't kind of increase and give the bad bacteria more muscle, and it's harder to treat when next you're treating that infection. All right, so let's talk about what's next. So in terms of this medication, if you are a coffee drinker, if you are going to take this medication, this medication can increase how your body reacts to the caffeine. So you can actually increase how long the caffeine stays in your system by decreasing the digestion of the caffeine. So you might react a little bit differently to the caffeine. So it might take a little bit longer for the caffeine effect to wane. So just be on the lookout for that if you are going to take coffee while you're on this antibiotic. Also, like I said, if you start noticing some severe diarrhea, try not to take any medication before contacting your doctor. You want to make sure that you contact your doctor first to make sure it's not a C. diff form of bacteria before you start treating that condition. If it's a C. diff, you just don't want to use any type of medication and keep the bad bacteria, which is the Clostridium difficile, in, because you've taken an anti-diarrhea medication and now you're having some more rumbling going on in your stomach. So make sure you're reaching out to your doctor first, making sure that they're aware that you're taking this CIPRO medication and it's not a C. diff before they prescribe a medication to treat that diarrhea. And also, like I said, this diarrhea may last for more than 2 months, even after you stop this medication, depending on if it's C. diff or whatever kind of diarrhea it is. So make sure that you are reporting that medication to your doctor as one of your meds. That way they can tailor your medication treatment to that. Also, in terms of the tablet, making sure that you're swallowing the capsule or the tablet. So in terms of the tablet, make sure that you're swallowing this tablet as a whole. If you're not able to swallow the tablet as a whole, you want to make sure that you break it at the score line, and you can just take the 2/2 of the tablet and swallow it with a glass of water. Like I said, make sure you're staying away from dairy products like milk when you take this medication in order for it to work effectively. I know this is a handful in terms of what information to know, but make sure if you're not able to keep up, you can pause the video or write it down. That way you're on the lookout for what to expect while you're taking this medication. If you did enjoy this video, make sure you give it a thumbs up, as well as subscribe to our channel in order to support our community here at DamiRx Care. We look forward to seeing more of you on this channel, and stay blessed.